crack expands and contracts? Well, first of all, it weakens your tooth. It's pressing on the good parts of the tooth. Second thing, the bacteria is seeping in through that crack into the inside part of your tooth. And when bacteria seeps into the inside, do you know what it does? I'm using questions all through here, right? It decays. So your tooth is decaying from the inside out. Most likely, that's 99% of what I find when I go into the tooth, because of that crack. This crack left untreated will only begin to decay further. That decay will begin to head toward the nerve, and you know what happens when it heads toward the nerve? You have dental pain. I know that you don't want dental pain, do you? No. Is this something you're concerned about? Yes, it is. Okay, now I can tell you what I can do about it. But I'm not going to tell you anything that I'm going to do about it. I'm not going to use the scary root canal word. I'm not going to say it'll end up in a root canal. I'm not going to say that. Because patients hear that and they go, yeah, right. Because we've used it so much to try to motivate them. The word root canal doesn't motivate. Pain, infected nerve, causing a more expensive procedure. It's called a root canal. But I'm not going to use the root canal as the sword. All right? It just is unfair. And plus, people don't hear it anymore. Right? So with the descriptive language, see, most of our population in the United States anyway is visual. They think visually. So when you use your language to paint a visual picture, they begin to see it in their mind's eye. And when they can see it, they can own it. And when they can own it, they can say, what are we going to do about it, Doc? But if you just say you have a cracked tooth, well, that doesn't have much impact on you. You have an open margin. Well, so what? You know? So you've got to describe, or at least it works to describe, what is that doing to this situation, okay? Use leaders and trailers. Did you hear me as I was sort of doing that demonstration? The leader and trailer. A trailer is a little phrase at the end of a sentence that says, does that make sense? Are you comfortable with that? Am I understanding you correctly? So it's a little question that keeps you engaged. Whenever someone asks you a question like, how do I get to the Empire State Building? You start thinking, oh, we're on this street. People ask a question, you normally start thinking of an answer. So to keep your patient engaged, you want to keep asking these little mini questions. And most people's attention, if you go more than 30 to 45 seconds without asking a question, you've lost them. I have one doctor in California I work with, and I make her, she's a fabulous dentist. And she explains care really well, and she connects at a really intimate level. But she never shuts up. She never says, how does that sound to you? Are you comfortable with what I've talked about so far? Are you ready to get started? So her whole thing is like every 30 seconds she's got to ask a question. And it's working, so that's a good thing. All right.
What's an example of
a leader? A leader is thank you for bringing that up. A leader is a phrase you put at the beginning of a statement. And the one I used the most was, if there were a way that we could restore your tooth in 2 visits, and then you wouldn't be hurting, you could chew on it, is that something you'd be interested in? If there were a way, that's a leader. Another leader is, did you know that gum disease and bloody, pussy gums actually are connected to heart disease? Did you know that? Did you know as a leader? If there were a way, am I on track? If I'm understanding you correctly, that's another leader. That's a great phrase to use when you're leading into treatment. But I use if there were a way all the time. All the time. This condition, left untreated, will result in, and don't say root canal, don't say, bridge. This condition, left untreated, will result in, what is language that you could use other than root canal? This condition, left untreated, will result in
a little infection.
Terrible pain. Terrible pain. Now that was sort of good, but let me tell you, you used a term that we call minimizing terms. Little infection. In the mouth, is there ever a little infection?
No.
It's an infection. And what happens with infection? Do they ever heal on their own? No, they don't. They get worse. All right. So this condition left untreated will lead to more infection, deeper infection, and infection that is really heading toward the nerve of your tooth. Could be terrible pain associated with this. So you want to begin to use your descriptive language as what this condition left untreated will result in. All right? And we're going to practice that in just a second. Eliminate limiting terms. You beat me to it. Limiting terms are a little crack. We have a little infection here. We're going to watch it. Those are all limiting terms. We have a little concern here. So does that mean you want to say, oh, we have a huge problem when there's not one? No, you don't have to say that either. But you can say, Ms. Jones, I'm concerned. I see a crack here in your tooth. I know it hasn't started to hurt you yet. Yet is a great word. Yet. And I'm concerned if we leave it too long that it'll result in a greater problem for you. Does that make sense? I use my little trailer at the end. Okay? So that's how you use your eliminate minimizing terms. You want to maximize the condition and minimize the sound of the care. So we haven't gotten to care yet, but I'll just share with you. Like, so what we'll do for that cracked tooth is we'll remove gently the parts of the tooth that are diseased. We'll take away all the unhealthy parts of the tooth. We'll seal the tooth with some solution that'll help protect the core of the tooth. And then we'll build a beautiful porcelain tooth on top of it called a porcelain crown. And that, if you take good care of it, can last you a very, very long time. So I'm describing what I'm going to do before I name it. Describe it before you name it. Because if you name it first, you say, oh, we're going to do a crown there, then they think $1,000. All right, so I want to say we're going to build a beautiful porcelain crown. I work with this incredible lab. It'll be stronger than your natural tooth, and it'll protect that tooth root, which is actually what's keeping your jawline so nice. You want to always protect the tooth root. People think their tooth is just the part above the gum line. All right, and that's just like the tip of the iceberg. The biggest part of the iceberg is below the gum line. That's another word picture you can use. Use your photos, models, x-rays, ask questions. What do you see? When you use your camera and you show pictures, what do you see? What do you think will happen to that left untreated? But then they say, well, Doc, how long do I have?
Yeah.
Right? How long do I have?
How long can I wait?
That's a great question. I don't know. I don't know. It could last you a year. It could last you a month. Just don't call me on the weekend.
Quite often, when patients ask me that question, so it's kind of like the gas in your tank, You don't wait till you run out of gas to pull it to the gas station, but you might wonder, how far can I get?
How far can I
30
push
miles?
it?
Yeah.
Right. Unless you're 17.
Yeah.
All right. So, leaders and trailers, here's some. I forgot that I had that in there for you. Here's a list of them. Have you ever considered, would you be more comfortable with?